Before I get into what I'm going to talk about, I want to again thank some people and introduce some people because we had to rush through that a bit this morning. So first of all, these are our conference sponsors. We had 11 of them this year, and they really helped us bring a very high quality set of speakers to you, high quality lunch, and of course they were all at the expo, so I really want to thank them. So for those of you in the room, if you'll just raise your hand if you're a conference sponsor. Also welcome all of the districts. So again, for the third year in a row, we have all districts represented. We have one district that's not here today, but they were at the event last night. So we can say again that all districts were at this conference. I think that says a lot about the school districts in Williamson County and the collaboration among all of us. This is our conference planning committee. So I'd like, if you are on the planning committee, for you to raise your hands. I will tell you that this committee met multiple times, starting back really in April, and it took us a while to get going and figure out what we wanted to do. We had a lot of discussion. I really want to, she is here. I really want to give Leslie Yonka of the Georgetown Project a lot of credit because she came to us and said, hey, we'd like to bring in Kent Pickell and some other high-level speakers, and we're willing to host a pre-conference dinner if you want to connect it to the conference. So really enriched what this conference has become. So thank you so much, and thanks to the Georgetown Health Foundation also for participating in the funding to get the speakers here. So let's give them a round of applause. These people were not on the conference planning committee, but they did a lot of work. And so, is Doug in the room? I was hoping he was, or out in the hall maybe?
He's taking care of this.
He's probably cleaning up. But if you see Doug tomorrow, please pat him on the back. This guy is logistics. He coordinated everything. He set up tables. He made sure the food was here. He did all of the grunt work that goes on with a conference. And so he probably hates all of us by now because we've been directing him all over the place. But he really has done a lot. So please give him a pat on the back when you see him. And there's Doug. So thank you, Doug. You missed all the great things I said about you. But
You can go ahead and start over.
All right. Lauren is our receptionist out front. She's so much more than that, though. She coordinated all the conference emails. She created all the sign-in sheets, the badges, just did a ton of work. And meanwhile, she's about to have a baby. So she's hung in there, has not been feeling good at all, and we expect her to have her baby any day now. So she's sitting at the front desk out here. You might want to say thanks to her on your way out or at some point tomorrow, because I do think she may have that baby any day now. So, but we really appreciate all of her hard work. So I'm going to switch now. I want to talk to you guys today about the Children and Youth Behavioral Health Subcommittee of the Mental Health Task Force. So a lot of you in this room have come to the meetings or have been to a meeting at least before. If you have never been to a meeting, if you please raise your hand if you've never been to a subcommittee meeting. Okay, so we do have quite a few folks here who have not been to a meeting. Can you also raise your hand if you've never heard about, if this is the first time you're hearing about the subcommittee? Okay, all right, so someone pointed out to me today, I'm not going to say who it was, but someone pointed out to me today that we really need to do a better job of marketing what we do and getting leadership in the school districts to come to these meetings or to send representation to these meetings. And so that's really kind of what this session is intended to be about. So I want to tell you a little bit about the subcommittee. We started after the first Mental Health in Schools conference. We got a lot of feedback at that conference from everyone that attended that said we need to start having these meetings more regularly. So we started it in March of the next year, and we've been meeting monthly since then. So far, we've had 30 total agencies represented, and I'm not going to read through them all, but these are some of the agencies that have participated. So a lot of nonprofits, a lot of behavioral health providers and organizations, a lot of government agencies, And then a lot of the school districts have been there. We haven't had every school district in Williamson County attend these, but the majority have. What we really need is more of a school district voice at the meetings, and a broader voice. We tend to see 2 or 3 different districts, and we haven't heard from lots of them. So we would love to have at least one representative from each district attend these meetings so we can have more of a coordinated approach. The other thing I'll say, I think Rhonda Neal Waltman really spelled it out. I mean, we still have, with these meetings, a really messy closet. We haven't had consistent attendance from enough core folks to really do strategically what we need to do. So that's an area of growth for this subcommittee, and that's what we'll be hoping to do using a lot of what she taught us today. Our vision for the subcommittee is based on the upside down snowman that you've all heard about, and we heard a little bit more about today, but really making sure that we're paying attention to prevention, early intervention, and system of care when we're talking about needs and services in our community. So our vision is that the children, youth, and families of Williamson County will be supported by a seamless, integrated continuum of school and community services and supports that promote behavioral health and well-being, enable early identification of concerns, and ensure that we're using the least intervention needed for all of these issues. So that's been our vision from the start. I want to talk about what we do. And so this was defined in what we initially wrote as our vision, mission, and goals. So the first thing that we said we wanted to do is identify and take action upon issues impacting the mental health and well-being of the children and youth of Williamson County. One of the first tasks we did, and we started it at that initial conference, is we prioritized some goals to submit to CapCog so that the community could apply for some grant funding to address some of the needs. We also used that as a way to determine what this subcommittee was going to start working on. What were the priorities at that time? So another thing we've done in this area is we've applied for a number of grants, collaborative grants out of the subcommittee, where we've had the subcommittee submit letters of support, and each of the individual agencies that are there submitting letters of support. We applied early on for a systems of care grant, and we did not get that grant. We were a finalist. We came down to, I think, 3. And so we were one of 3. We were able to get some services still from systems of care, but we didn't get that grant, so that was disappointing. The health district received a tobacco grant through the support of the subcommittee. Bluebonnet received a very large grant through the help of the subcommittee, Texas Children Recovering from Trauma, and I'm going to talk about that in detail in a little bit. And we are currently pursuing, Juvenile Services is pursuing some truancy diversion money through TJJD that this subcommittee has also supported. So it's really helped us to get these grant monies when we have all the agencies coming together to support the cause. Another thing we wanted to do was identify and take action upon issues impacting substance abuse and abuse issues affecting health and well-being of our children and youth in Williamson County. So we identified that right off the bat as the #1 need, substance abuse treatment as the #1 need for youth in Williamson County. I will say that today that remains the #1 need that we are working on. Some of the things we've done, we brought Michelle Bias from Region 7 of DSHS to a meeting. We also, some of us on the subcommittee, attended some stakeholder meetings down at DSHS related to substance abuse treatment in our region. And what they told us is that in our region, we have the largest gap in service. Williamson County does. So they are aware of that. We're making them more aware of that. We're working on plans with them to find out how to get providers to come to Williamson County. Unfortunately, with substance abuse treatment, what's happening is we have providers, but they're all in Travis County. They're all in Austin. And we know that most of our kids and families can't access those services regularly. So the great news, and Bluebonnet's in the room, but Bluebonnet Trails will be opening an intensive outpatient services for youth in January in Georgetown at their the site where their respite center is here in Georgetown. So I believe, Holly, you said those services be it for 12 and up. Is that correct? 12 and up. They're already serving adults. They've assured us that youth and adults will not be mixed. They'll have separate days and times when those clients are there. But we will finally have intensive outpatient services in Williamson County for substance abuse for youth. So I want to really thank Bluebonnet Trails for working on that project. The other thing we're doing, and we did this at our last meeting in October on Halloween, we brought some other providers, some of the Travis County providers and providers in our area to the meeting, and we're trying to engage them and figure out some planning to bring some more services to Williamson County. So we had a lot of discussion about a potential IOP in another area of the county, maybe in the eastern portion of the county. A lot of discussion about how do we link substance abuse services to our schools. And so that's an ongoing mission, but I do think we're starting to make some progress there, and we're starting to see that some services are coming to Williamson County. The other news that I've heard, and it's not confirmed yet because they're still all trying to figure out exactly what they're doing, is the 2 new psych hospitals that will be coming to Georgetown have also discussed the potential of providing substance abuse IOP services for youth. So we're still waiting to confirm that, but they'll both be opening up next year. Another thing we do is facilitate cross-sharing of knowledge and perspectives from diverse groups. So that's obviously what we've done here today. We do a lot of, this is probably the primary thing that we do at our meetings, a lot of sharing of knowledge from those that come to the meetings. The Texas Children Recovering from Trauma Initiative, Bluebonnet Trails, is doing a lot of trauma-related training for the county, and I'll discuss that in more detail in a minute. We also have some other collaborative training opportunities that I'll give you some details about. Policy recommendations. This is an area where we have not gotten strategic enough to really do what we want yet, so I'm hopeful that today's training will start guiding us in that direction. But we did address youth legislative issues with Representative Gonzalez in 2012, and then with Senator Schwertner, who'll be here tomorrow, in 2013. So we did have a conversation with them. What we'd like to do for the next session is have something prepared that we can submit to the legislature about recommendations and what our needs are. So there's a great model that Linda Meigs has found that Harris County has done, and we're going to look at that model and see if we can do something similar. Cultivate a broad range of voices to help advance children and youth behavioral health awareness. We've done a lot of this. So at our meetings, as I mentioned, we've got 34 agencies. A total of 86 folks have attended those meetings over the year and a half we've been doing this. We've hosted 2 children's mental health awareness events that have been real powerful for the youth. They've really enjoyed those. We participated in suicide prevention awareness events along with the Mental Health Task Force. And then we have a Youth Voice project that's ongoing where we have gone around and interviewed different sets of youth and asked them questions related to behavioral health. We've gotten permission to record those, and we're going to have something we can publish at some point. We also have, and Sue, I may ask you to chime in here, we also have a youth Facebook page, a Youth Voice Facebook page that we created, but we need to really get more use out of. So do you want to say anything about that?
Right, the Facebook page is just a place I actually posted the questions that we really want to hear from the kids about what they see, what their needs are, and how we can meet them better. I think they're reluctant to put it out there on the Facebook page, yet they'll, it's kind of ironic what they put on their own Facebook page. but with the encouragement and guidance of adults, trusted adults, to sit down and go to that Facebook page and guide them in maybe answering that question, some of those questions, maybe just 1 or 2 of them would be really good. So to just go to the page and look at the questions and have them respond to 1 or 2, that would really help give us some feedback.
Okay, thank you, Sue. So our biggest partners have been our youth, and I want to focus on them for a minute. So this is the artwork that won first place in those children's mental health awareness events. So those were the state contests, and the kids created these. Really, I got to also thank Lynn Kessel, who's here. She's our counseling supervisor here, but also does a lot of artwork, and she helped these youth create a lot of these projects here at Juvenile Services. But they've really benefited from doing these types of activities and winning the prizes and getting to receive the accolades. This is another one of the poems that a youth ended up reading in Commissioner's Court on Mental Health Awareness Day. And then we also had a Battle of the Bands event in Georgetown where some of the kids did a children's mental health awareness stomp routine too. We had several different groups that came and participated in that as children's mental health awareness. So we're really trying to put them in positions to lead. We had for a while, we had 2 youth members on the subcommittee. They've not been in contact recently, but that's another thing we're looking to increase is our youth voice on that subcommittee. A few things that I want to highlight that are not entirely the doing of the subcommittee, but I think they're collaborative outcomes that have come as a result of us all being together. The first one is our neighborhood conference committee, and many of you have heard of this. Any of you have you not heard of this? If you could raise your hand. Okay, so there are several in the room that haven't. It's a county-wide truancy diversion program. So it's really the work is done by community volunteers, and it's a level of intervention that occurs prior to a school district filing on a youth and sending them to JP court for non-attendance. And so we created that tier in hopes that we could keep kids out of JP court, ultimately keep kids out of juvenile services, and obviously get them back in school, get more funding for schools based on attendance. So a lot of great things, and most of all, of course, that the student is back learning and being productive. So we started this in the Round Rock School District, then we were in Taylor and Georgetown. This year we're in 8 ISDs in Williamson County, so we've really expanded, and it's a collaboration amongst a lot of partners, a lot of ISDs, the JP courts, juvenile services. I wanted to highlight 2 sites in particular so you can see the level of collaboration. The Taylor site is now located at the Eastern Williamson County Bluebonnet Trails office, so they've allowed the NCC site to occur there. So the beauty of that is you've got Taylor ISD there, you've got juvenile services there, and you got a lot of kids with a truancy issue that many will have a mental health issue, or maybe their parent has a mental health issue that can immediately funnel into services at the Bluebonnet Trails. Yes, Sue?
Just want to make sure they understand why Taylor ISD is there. Because we have a site coordinator that's a representative there for, they're the ones that have access to the student demographic, to the memorandum of understanding. They're the ones that have access to the demographic information, and so we collaborate through that shared information.
Sure. So each of the NCC sites have an ISD employee who functions as part of this program as the site coordinator, and that really helps with confidentiality and access to youth and the communication piece. The site at Hutto is similar but a little different. So the site's at Hutto High School. Lone Star Circle of Care has a behavioral health and a medical clinic at Hutto High School now, so that's already a great collaboration. And we've added NCC to that collaboration, so there you have students that are truant and their parents that will be going in. They'll meet with volunteers. Volunteers will give them a positive action plan, and in many cases they can step directly into the clinic and receive whatever services they may need if it is in fact a medical or a behavioral health issue that's impacting the truancy. So some really smart collaborations in both of those 2 districts. Outcomes, the outcomes as far as a juvenile justice outcome has been incredible. So we've had for 2011, 2012, we had a 90% success rate. As far as the kids that entered NCC, as a tiered intervention did not end up going to the JP court or to district level court for an offense. So now that's a great number. The reality is not all of those kids were incredibly successful in getting back to school. But it was at least an intervention that slowed the problem down and provided some intervention and kept them from going all the way. All right, Sue's got another comment.
Well, I want to make sure they know that still the overall economic improvement, like she was talking about earlier, to the school district was, like, we tallied up the amount of money for Round Rock, and we kind of lowballed it because we only looked at their second and sixth block, which are their attendance blocks, and multiplied their daily rate, not their special education rate or anything. They get reimbursed by the state, and then we looked at the percentage of days before they were entered the program that were in school, percentage of days after, and then how many absences before and how many absences after. And we determined that through that intervention, we saved Round Rock over $20,000.
So yeah, and I do want to stop for a second and give Sue and her team a lot of credit, because they have developed a really great database in conjunction with the school districts that's tracking not only the outcomes that we need for our grant or for juvenile services purposes, but also the data that the school really needs to show that this kind of program is working and to show the success. The grant requires that we follow the kids for 6 months, but we're tracking them until graduation, until completion, so that we'll know the long-term outcomes of this intervention. Just from a financial standpoint, the subcommittee coming together and supporting the governor's grants, Juvenile Services has benefited. We've applied for grants and been awarded $184,000 toward that truancy diversion program. And we also were awarded $140,000 toward vocational programs, so programming for our youth. So we've had 2 years now of the vocational program. Last year we opened it up, and so it wasn't all Juvenile Services kids. There were some community youth that were, there were a few from Round Rock I know, that were able to go to a certified nursing assistant vocational program and graduated and passed. And so we don't have how many of those youth have obtained jobs yet, because it hadn't been 6 months out. But our first year, 11 of the 14 kids that went through that vocational program and got jobs. So we saw some really good success with that. Bluebonnet Trails, I talked to you about the Texas Children Recovering from Trauma Initiative. So they trained 115 mental health providers through this grant in trauma-focused CBT. Juvenile Services, we were able to send 7 counselors. We have so many youth in our system that have traumatic events occur, multiple traumatic events occur in their lives, so really benefited us. Through their services, they've had 723 youth screened for trauma. 55 of those received trauma-focused CBT, and that was a total of 335 sessions. So it really is a great grant that allowed us to address some issues that are hopefully benefiting the schools and the youth that are still in their home campuses. We also use that grant to access some training for our staff. So we've now trained all of our juvenile supervision officers and all of our juvenile probation officers in a national evidence-based curriculum for trauma-informed care. So it's really impacting the way that our staff approach issues with kids that have had traumatic experiences. Last year at this conference, the youth that presented, I don't know if many of you were here, it was a phenomenal presentation. It was probably the strongest presentation of the conference. They went on to present, just wanted you to know how it went from there. They got a lot of business cards at the conference saying, hey, please come present for us. So they went down to a Juvenile Support Network conference at UT, and they presented at Thompson Conference Center to almost 500 people. Those were some really high-level folks in the room. I went to that presentation, and there were people crying all over the place. They got 3 standing ovations. So you can imagine how that impacted their lives. And back to kind of what Kent Piquel was talking about this morning, I think for a lot of them, that was that aha moment for them where they really felt competence and felt like they were of value to the community. They went on again and presented to TEA and really talked to a lot of the after-school program coordinators about, what it's like to be in the juvenile justice system. And Candace is here; she helped coordinate that event. But another, again, really well-received presentation. We were contacted through Bluebonnet's grant by DSHS, and they came out and asked our youth to create a brochure for trauma-informed care that they are about to implement and use. So just really want to highlight, when we put our youth in these leadership positions and give them an opportunity, how wonderful they can be. So, telling you all this because tomorrow afternoon, the final presentation is from Round Rock ISD teen parents. And much like last year, I want to guilt all of you into staying until the end because we do believe it's going to be one of the best presentations of this conference. And Sue has seen the presentation already in action. We really think it's going to be strong. It'll be different from last year. But again, giving these teen parents a voice, and let's hear what they have to say. The last thing, and I'm going to go over this really quickly because I told you I'd get you out early and it's 2 minutes till. We do have some training collaborative opportunities, and you have some information in your binders so that you can refer to. It's in Section 3. Juvenile Services is providing motivational interviewing training. We're also doing 40 developmental assets. The Georgetown Project provides asset training as well. There's a sheet in your binders about parenting with love and logic. That's here in this room, and the dates and contact information is there. We usually have room for several community parents in the room, so or anybody in the room can come to those, and we've listed out what they're going to be for the next year. Mental health first aid is now being offered by Bluebonnet, and there is a sheet in your binders that talks about how you can access mental health first aid training. Trauma-informed care training still being provided by Bluebonnet Trails. Do you guys have any updates on those two?
No, and we are going to also be moving towards training for parent-child interactive care. That will be in this next training.
Okay, so we'll make sure to get everybody in this room parent-child interactive therapy updates. Yes?
I just wanted to make sure you restated that. I don't think everybody heard it.
Okay. And then Bluebonnet is also doing assist training, and there's a brochure in your binders about that, but it's a suicide intervention skills training. And so what we would like to do more often than we have in the past is not just rely on this one conference to do collaborative training, but really provide some opportunities to get together. So we'd encourage you to contact Bluebonnet. We will put the word out. We have everybody's email address that's in here. Anything we're going to offer here, we're going to do a better job this year of communicating that so that everyone can access it. And this is the last piece. In your binder, in the back cover, you have two documents. I just want to draw your attention to them. One of them is a training evaluation form. That's your pink form. We really value your feedback. We've used it over the last 2 years to plan conferences to try to figure out what kind of topics to bring and what we could do better. So please fill those out. Take some time to fill those out and make sure to leave them with us by end of the day tomorrow. And the second piece is there's a training documentation form in there that you can take back and use for your purposes. We don't need those back. It's simply for you to use. And for those of you that are LPCs, we are offering CEUs, and we can get certificates tomorrow to you.
Also LC.
And our understanding is if you're a social worker, that the social work board will take LPC CEUs. So I would also grab a certificate if you're under the social work licensure. Conference tomorrow, 8 a.m. sharp, so please get here on time and stay to the end. Thank you all very much. It was a great day. Thank you so much.